All right, so gotta make this video. If you've ever experienced any hip pain, tears, arthritis, pinchiness, all those things, and I'm speaking from experience, I've always mentioned that I have chronic pain. So my issue has always been hip pain. First my left, and eventually overcompensation is the right. So I'm always looking for information. How can I get hip? So this video is for you if you're suffering from hip pain. And I am no medical professional. This is not medical advice, none of that. I'm just sharing you my experience and everything that I've researched and tried, because I've tried many things. I've gone to many doctors, physical therapists all over the country. I spent a lot of money, and there's always something that was missing. They give me their techniques which would help other people, but for some reason for me, I kept having this issue. And looking back now, it makes total sense. So what's important is the main thing. Our hips as a ball and socket, right? But when we sit down, and especially if we work out, or especially we're runners, because I used to run so much. When we run so much, all these muscle tissues get tight to the point where it restricts our joint. So sometimes we try, physical therapists, massage people will say you need to stretch, you need to mobilize, and yes, those will work. But why do we keep having hip pain? What's the problem here? So, from my experience, personally, just me, it was a very, very tight hip capsule. But it wasn't just that, because sometimes you'll be restricted that you cannot access the hip capsule. So you'll feel more pain when trying to do what you're supposed to do. And so for me, I was doing things like I was supposed to do with physical therapists and all these people, but they were missing a piece, or I still have pain, so there was no solution. So for me, even though I still have pain, there's still, leftover damage, but I'm trying to spread awareness to some people that maybe have issues and they don't know what to do. Or, I know many people that have this issue and they're not healing, and it's been 10, 20, 30 years for a hip, and they get a hip replacement. And sometimes it can be avoidable, in my opinion. Again, it's not medical advice, but the hip capsule is tight, so it pushes your hip forward out of alignment. You basically have a dislocation hip socket, and even if it's dislocated a little bit, you may not feel pain, but it's going to limit your range of motion. And so when you start walking, especially start running, start exercising, it's going to get stuck, and it's just going to tear down over time. So that's the issue. So what helped me a lot is to get a lacrosse ball and just massage yourself all over the area. And it's not just, it can be the TFL, something that many of us neglect because it's hip flexor, and we're so hyper focused on hip flexors, but not the right ones, because there's multiple. So you have the iliopsoas and you have the psoas muscles. That's what usually we stretch out, but you have one that's to the side, more inner, medial, lateral hip flexors, and then that will rotate your pelvis. So if your pelvis is rotated and you have a dislocated hip, it's a very wonky, twisted rotation, and it can just travel upstream, downstream to your entire body. So you need to look at what is rotating your hip, which way. You can tell by looking at your feet and your knees. Is it out, in? Is it straight? Is it aligned? And it's going to affect your ankles and knee. Everything's connected. If your hips are off, your spine can be off. If your spine's off rotation, now your rib cage. What's connected to your rib cage? Your arms, your shoulders, and your cervical spine. Everything is going to be affecting each other. Then you get into deeper stuff, like if your spine, cervical spine is twisted, now you have pressure, rotation, tightness, your jaws, your symmetry in your face, your muscles in your face, the bones in your face being pulled, tugged. Then you have the ones up here in your head and your scalp and your skull, the cranial nerves. I'm not a professional, but I've just learned so much going through and trying to figure out answers. So sometimes we need to go deep. Sometimes it's not as deep. You just need proper stuff. So I would invite you to just take a look. And I don't mean, I can't give you medical advice, but just take a look at, hey, what's tight over here? And don't always just hyper focus on your hip, because that's what I did. You hyper focus on the hip, but the hip isn't the root issue. Something else, and it could be a symptom. It's crying for help. It could be a victim of something else. Upstream, downstream, right at the socket of the hip, and you're feeling hip pain in the front. So, yeah, if you guys are watching, this is why I made this YouTube channel: holistic, eating healthy, being right mentally, emotionally, spiritually. Most important, we need to have that spiritual connection to feel connected to all, and really even go deeper. Why do we have hip pain in the beginning? On a spiritual level, we have the physical level and a spiritual level, but right now we're just talking about the physicality part. If you are struggling with hip pain, take a look at your hip socket, hip capsule. Those are beyond the muscle tissue, the soft tissue. You have the muscle tissue, like your muscles, like your glute muscles, your quad muscles. Then you go deeper and you start to have tendons and ligaments and stuff, and those will get compromised as well with the superficial layer with the muscles. And then you get joint adhesions around the joint, and it just throws your mechanics and everything. So for me, sitting has been one of the major culprits, and not just sitting, but working out, not stretching along with working out. So I see a lot of people who sit a lot, but they may not work out, and then they have issues. Why do they have all these? They don't have issues. I do exactly what you do, and they don't have issues. Why do they have issues? And I don't. Or no. Why do they not have issues? And I do. Right? So it's because everyone's different, and we sit different ways. You might have your leg out when you're driving, and this in, so then there's a rotation in your pelvis. And so sometimes the muscle tissue itself, just stretching your quads, stretching your glutes, is just not enough. You have to go deeper and get adhesions and unglue all those things. So just take a look at deeper, not just, ouch, my hip hurts. If no physical therapist can help you, then start doing your own research and look around the pelvis and start looking into the capsules. But again, nothing I'm saying is medical advice. It's just what I've gone through, and hopefully it'll give you some more awareness to take a look at things for yourself, be your own doctor, and see what your body specifically needs. Because everybody's going to have tightness in different areas, different spots of their glutes, because the way we sit, the way our muscles work, the way how long our femurs are, where our bones are, there's so many different structures, but your body will tell you. And it'll say, I need stretching right here. It's tight here. I need to unglue this part right here. And then you start to see, okay, I have more range of motion. I'm on the right track. I have more range of motion. I can move better. Maybe I feel a little bit of pain when I do this, but I need to continue to go here, go there. I need some more of this and some more of that, right? So hope that helps. If you like more of this content, I can continue making more videos on my experiences. So just let me know if you have any questions, and I'll talk to you guys later.